So thank you for the introduction. So this is showing you some of the results of some of the work that we've actually achieved over the last year. And I appreciate that some of the audience have already seen this, but we'd just like to present on behalf of Emily, who you can see in the box on the screen, and Bex, who's just talked to us about Connect study. So spring 2021, the spring of discontent for many a haematologist, I think. So VITT was recognised and it caused quite a lot of rapid learning, dissemination of information. And as a committee, I remember chatting about a year ago, thinking, how can HaemSTAR help with this? And we appreciated that we were a network of haematologists, young haematologists who were enthusiastic to help in whatever way we could, certainly to the consultants who are in this room and we've also supported. So we were able to disseminate information on how to report cases of VITT, also promoting biobanks on the website, and also data collection if it was required from individual sites for PHE. Then PHE contacted us separately to say, actually, wouldn't you be able to help us collect some data that we're looking at, and I'm just going to present some of this data. And they published this in the Lancet in the latter part of last year, or beginning of this year even, looking at coding data and looking at the relative risk and adjusted risk of having COVID vaccine then causing venous thromboembolism. So the issue with that coding data was actually they had no kind of clinical information. Were these codings right? And we quite often are aware that coding is incorrect, particularly for thrombotic disorders. And actually, what are the laboratory parameters of these patients who are coming in? So they were based upon a coding of thrombocytopenia and thrombosis, but actually they didn't have any clinical information. So that's where they asked us to review this. So we basically contacted HaemSTAR, go through what we did, to look at the coagulation parameters and identified potential cases of VITT looking at the cohort that we obtained. So we looked at the first quarter in 2021, which is when VITT was recognised before it was then pulled and switched over to Pfizer and other vaccines. So what we got from PHE was a list of a very long list of sites and potential cases that they'd recognised with an ICD-10 code of either cerebral venous sinus thrombosis or other types of VTE. We then contacted HaemSTAR members, the regional leads, and then disseminated that to identify people in sites that they'd identified cases. And everyone was blinded at that point, hopefully, to the vaccination status of the individuals recognised. We then, the three of us, the three collaborators who I mentioned earlier, we then looked at the quality of the data. So it was input onto an electronic reporting scheme and then given back to PHE, who then provided us with a spreadsheet of data. We still remain blinded to look at patients according to D-dimers and thrombocytopenia. And then we were unblinded, so we could then hopefully identify potential cases of VITT according to the expert panel, of which some of the authors of that are in this room. I think one of the key things was that we were able to reach out to quite a few sites. We identified 31 sites who were willing to help with this study. We were able to confirm 207 cases, and we excluded some about 50 more because they actually didn't have thromboses. So we identified what we thought was actually over-reporting of thrombosis or not quite right cases of thrombosis. We then had data on blood test results, and we had about a 50-50 split of those who had VTE coming over that quarter, who were vaccinated or unvaccinated, with a subpopulation of those who had vaccines greater than a month prior to their VTE events. So this is just looking at some of the thrombotic events, and actually what we saw was higher prevalence of PE in this cohort, and actually there wasn't an representation of cerebral venous sinus thrombosis, although we were positively selecting for those patients by the ICD-10 codes. If we looked at the clinical features, there was a ponderance to female gender. We also showed that the admission platelet counts when you put all the unvaccinated patients was lower and the nadir platelet counts were lower, and also the fibrinogen was lower, which has been recognised part of the clinical entity of VITT. So we felt that somewhere in the vaccinated cohorts that there was probably a group that was dragging the numbers down, which was probably representing the effect of VITT in that cohort. So we then retrospectively went back to mark the cases according to the VITT criteria based upon the information that we had. We actually had 18 on laboratory parameters. We only had 18 cases of anti-platelet factor 4 assays recorded. So that actually meant that we weren't able to fully assess the patients, and we had to exclude quite a large of them. Nearly half the patients we were unable to assess. But we could see 14% of the patients had either had definite or probable VTE over that period of time who had been vaccinated. And I think looking back at the data, no one's actually had a look at temporal data comparing. And this is the first time that anyone's done that, looking at the vaccinated and unvaccinated cohorts to actually see what are their coagulation parameters over that period of time. And I think this is one of the nicest images that we showed was if we look at different colored dots. So we have the white ones, which are the unvaccinated patients, the blue ones, which had their vaccinations more than a month before their VTE events. And what we can see is the pink triangle dots are the patients who were within that 28-day period, who there was a subpopulation that we identified as having thrombocytopenia and significantly elevated D dimers. When we did correlation coefficients on the vaccinated population, there was a strong positive of 0.7 for that when we looked at D dimers and platelet counts, which may be interpretable as some sort of severity of disease. So, as I said, this was the first direct comparison of thrombosis and thrombocytopenia according to vaccination status, and PHE were then able to re-input that data and able to work out the relative risk of having a vaccine and then developing a thrombotic thrombocytopenic episode, which we showed to be 4 for cerebral venous sinus thrombosis and by 2 times for the other VTE events. So quite significantly elevated after the first dose of the Oxford AstraZeneca vaccine. We identified a proportion of patients who had VTE that met the VITT criteria in early 2021, and those clear signals of different coagulation parameters in keeping with what the working group criteria was for VITT at the time. So that's what we've been up to. Sue's asked kindly to remind if any cases of VITT, please continue submitting these cases to VATT